It's true. We don't focus on problem talk in solution-focused brief therapy. But the most important part of that statement is the we. We as in us, the therapists. We don't focus on problem talk. And I think there's a little confusion over what that means in relation to what our clients talk about. So that is what I want to talk with you about today. So welcome to episode 14 of Don't Forget with Anna Francis. I'm Anna Francis, the CEO of the SFU and a registered counsellor in New Zealand. And this video series is all about sharing my thoughts, ideas, and reminders about things we so often and easily forget when we're learning and practicing solution-focused brief therapy. In each segment, I focus on one key thing that I hope helps you while you're on your learning journey or keeping your SFBT skills sharp. So there's a bit of a myth around solution-focused brief therapy and the common misunderstanding around what problem talk is. Confusion around this comes up a lot in our training, and we hear common questions like, what if the client wants to talk about the problem? What if they just want to vent? What do we do when the client keeps going back to the problem? And they're all really good, valid questions. And I think understanding what problem talk actually is and the role we play in that should hopefully help to clear this up. So problem talk in of itself, of course, is talking about the problem, but we need to remember that anything our clients talk about is not part of that problem talk and the way we use the term problem talk. They are simply talking and answering our questions, and they cannot give us a wrong answer. But we, however, can ask the wrong questions. So when I say wrong questions, by that I mean questions that would fit if we were assessing the problem or asking questions for the purpose of learning more about the problem in a way that does not link to our client's best hopes. When we engage in problem talk, our questions lead us away or stay in the problem, and they go in the opposite direction of what the client's desired outcome actually is. And we don't want to be doing that. We want to make sure we stay in the direction of the desired outcome. Now, it's really common for our clients to want to talk about their problems and what has brought them to the therapy session, and that makes perfect sense. And we do need to give them space and safety to do that. But what then makes the session turn into problem talk is when we participate in that conversation rather than listening through what they're sharing to catch nuggets for client resources. So what do we do if our client wants to talk about the problem? We listen. We listen closely for nuggets that we can then ask them about later. And we listen to ensure that they feel heard and valued, and we acknowledge what they're saying. For example, if we ask our client, what are your best hopes from our talking today? And they answer by telling us all about the problems that they're struggling with. We listen, we hear what they share. But what we do next is what prevents us from getting caught up in participating in problem talk. So when they're finished, we then acknowledge what they've shared. For example, like, wow, that is a lot for you to be dealing with. Or, man, you have been through so much. Or you have a lot on your plate right now. And if talking with me today could be useful for you, what would you like to see begin to change as a result? Now, that will either switch our clients' thinking into what they hope to get from the therapy, or they may continue to talk about their problem. And again, that's okay. And we listen and we acknowledge and we re-ask our best hopes question. And we do this as many times as necessary until our client is able to articulate what their desired outcome actually is. It may just be a case of them feeling heard enough that they have some brain space to now think about what they do want from coming to therapy, because often they come expecting for us to ask all about their problem. So in my last video, I talked about asking the same question in a variety of ways. So it might be worth going back and taking a look at that, because we need to continue to ask a variation of the best hopes question to be able to establish their desired outcome. So we can then move on to the description. Now, we do the same if our client answers with just wanting to vent. The vent has a result that they want, so we need to be careful not to participate in the event and listen through it so we can acknowledge it and find out what they hope will begin to change as a result of coming to the therapy. Just the same as when they're talking about their problem. Doesn't mean it's easy, but we need to push through. So for example, what are your best hopes from our talking today? Well, I just want to have somewhere to vent. I would say, fair enough. It's good to get things off your chest. And if having somewhere to vent was useful, what do you hope will begin to change as a result? Now, they may say, well, I just feel better not holding things in. So I would be likely at this point to say, well, this is your session, and give them the space. The floor is yours. Share whatever you want. Now, the purpose for this isn't so that they feel like they're just getting what they came for. It's so that I can go treasure hunting and listen through what they're saying, collecting nuggets to ask them about once I've established their best hopes. Because remember, we can't move on from here until we know what their best hopes are, that internal change that they're looking for. Now, the other common question that I mentioned earlier is what to do when our clients keep coming back to the problem. Every answer is back in the problem. That is also okay too, but we just need to work harder to remember our role and our direction and ensure that we're weaving the client's language into our questions to make sure that they're being heard and valued and acknowledged. Now, this is where the word despite comes in, and it is super useful. For example, what would be a first sign that confidence and happiness are returning? They might say, well, that can't happen until my boyfriend changes because he's always on my case. I never feel happy and confident anymore. So we can re-ask that question and say, well, despite how your boyfriend makes you feel, which sounds really rough, what would still be a sign that you'll catch a glimpse of that confidence and happiness, even for a fleeting moment? This way, she's having her situation acknowledged. She knows I haven't dismissed how she's feeling, but I've removed that contingency of her boyfriend controlling her confidence and happiness and letting her know that her confidence and happiness is something that I know she can still have as she once did. We need to work hard for our clients to stay out of that problem talk and hold tight on our belief that the change they want is 100% possible. So thank you so much for joining me on the Solution Focused Snippet, and I really hope that this reminder helps you as you continue your journey of learning and growing. And if you enjoyed this video, please like, leave a comment, and share with your colleagues. And don't forget to subscribe to our YouTube channel so that you can get notifications for our other amazing videos all about using solution-focused brief therapy in your work. So until next time, keep being you.